Okay, our next speakers are going to be joining us virtually today. Dr. Saara Greene is a professor and director of the School of Social Work at McMaster University. Her research focuses on reproductive and maternal justice and barriers to care for women who experience marginalization along multiple axes of identity and across the lifespan. She's been leading an arts-based participatory research on women in cannabis since 2018, including the needs and experiences of mothers who consume cannabis during pregnancy and breastfeeding, and older women who use cannabis. She grounds her research in feminist, participatory action, and arts-based research approaches. Our second speaker is Gabrielle Griffith, who is a full-spectrum doula, sex educator, public speaker, and has a diploma in assaulted women and children's counseling and advocacy from George Brown College. Gabrielle works through a trauma-informed and anti-oppressive lens to help new parents and caregivers have a healthy and happy transition into parenthood that is sex positive and inclusive to all gender and sexual identities. They also offer anti-oppressive and inclusivity trainings for doulas and service providers in Ontario. Gabrielle is a non-binary and queer-identified parent who lives proudly with all of their intersecting identities in Toronto, Ontario. And before we get started, I believe we have a poem that will be read before the session. Is that correct? Wonderful. Come on up. I'm sorry, I don't have your name.
It's okay, I'll introduce you.
Wonderful, thank you.
Hi, everyone. My name is Brecklyn Bertozzi. I'm a community-based researcher at Women's College Hospital. I'm also a medical marijuana user. I have two beautiful, happy, healthy children, ages 18 and 4. And I took part in the research that Saara Greene did at Wading Through the Weeds, and this is one of my contributions to that research. So the poem is called A Breath of Fresh Air. At the end of the day, I need a little fresh air. Some green flowers are my way of self-care. A moment to myself to reflect, meditate, and breathe. It helps me to continue on, I believe. Some time away from responsibilities, motherhood, and work, a little something to lift me up and give me a perk. It takes the pain, stress, and anxiety away, a little break from the worry of the day. It keeps me going and helps me to cope. That's okay with you, I hope.
Hi, everyone, and thank you so much. Thank you so much for that, Brecklyn. And I just wanted to also say that Brecklyn was the artist of our Wading Through the Weeds logo. Okay. So just to give you a little bit of background about the project, we came to this project aiming to respond to the anti-Black racism that continues to exist in the Canadian health and public health policy and practices that exist today, and also address the Truth and Reconciliation Commission's call to action to address gaps in the health and public health policy and healthcare practices between Indigenous and non-Indigenous peoples. We also wanted to build on a small body of critical health and social science research that focuses on cannabis use during pregnancy, breastfeeding, and the postpartum period, specifically to focus on the experiences of pregnant women and mothers who are from more marginalized communities, particularly those that experience racism, the effects of colonialism, histories of drug use and child welfare involvement, living in poverty, and violence. We really wanted to sort of shift away from talking about the impacts of cannabis on the fetus and developmental aspects of a newborn baby and children to actually focus on the stories of mothers. This has been a massive gap in the research to get a better sense of why, when, and where, and how they choose to use cannabis. What drives them to that, what their histories of cannabis consumption are, and to think about how do we develop and improve public health approaches and clinical supports and social work supports to Black, Indigenous, and other unjustly marginalized individuals who consume cannabis during pregnancy, breastfeeding, and motherhood. We had two primary objectives of the project. The first was to garner the experiences of Black, Indigenous, and other unjustly marginalized individuals in order to identify and shape public health policies and practices that can effectively respond to their lived realities, and to generate new knowledge to strengthen public health and allied healthcare policies and practices that will increase access to perinatal and parenting information and support for pregnant and breastfeeding individuals who consume cannabis. We grounded our research in feminist, critical race, and anti-colonial theoretical orientations that really look at the ways in which gender, race, and indigeneity impact people's lives, and look at the context of people's lives, both historically and currently. We engaged in participant and community engagement processes throughout the whole entire research plan, where people with lived experience and working on the front lines were very much involved in developing the project as well as executing the project. And we used arts-based method of photovoice and storytelling as a way to create new knowledge. Importantly, to really think about that as a way to explore the more of the nuances of lived experiences that can help us to drive social change in both the clinical and social care realm. An important part of all of the work that we did and all of the workshops that we did were community engagement sessions where participants with lived experience attended the groups to talk about their own experiences of cannabis consumption and to also learn about the impacts of cannabis on themselves and on their bodies with the limited amount of information that we have at this time, and particularly accessible information that people can actually understand, digest, and consider as they make choices in their lives. The sessions were co-developed and co-led by a community research associate, an Indigenous elder or community leader, and an academic researcher.
And this is a photograph of from one of the participants where we learned and heard from many of them that cannabis is medicine and it's a tool that they use to support their daily experiences. So photovoice is the method that we chose for this project. Photovoice is a participatory arts-based research method that aligns with our broader commitments to FPAR, decolonizing, and Indigenous research frameworks. Photovoice is grounded in an iterative process of coming together with a group of participants to share and discuss and connect and collectively consider personal, systemic, and community-oriented forms of social change. Our intention with this method of using photovoice as a way to engage in a participatory arts-based process with Black, Indigenous, people of color, and other marginalized individuals in order to talk and learn about cannabis use in relation to pregnancy, breastfeeding, and motherhood. We did 4 different series of photovoice workshops with a net total of 23 participants, starting in October of 2020 throughout June 2022. We had one group of Black mothers. There's a total of 5 participants in this group. We did one with Indigenous Northern community members. There were 7 participants in this group. We also did a harm reduction specific group with women who had lived experience of using cannabis as harm reduction. And there were 5 participants in that group. And we also had another group specifically for younger moms, and there were 6 participants in this group. And something that feels important to note as well is that of the 23, only one of these individuals did not consume cannabis during their pregnancy. These are the questions that we asked during the photovoice sessions, each question flowing into the next one to allow people the opportunity to further reflect on their experience and relationship with cannabis, asking about what's their relationship with cannabis and their physical and mental health generally, and also as it relates to pregnancy specifically. What's the role that cannabis plays in their experience as a parent? How did they access this information? What helped them decide to choose to consume or not consume, and what methods they chose to use? And also we wanted to hear, what is their message? What do the moms, what do the parents and the consumers want to share with health and social care providers? And what would they say to them about their cannabis access and consumption as a pregnant person and parent? For the harm reduction specific group, we added an additional question to give folks the opportunity to share with us, how do they understand the relationship between cannabis and harm reduction in relation to their pregnancy, breastfeeding experience, or parenting experience? And for the younger moms group, we added an additional question around children's aid and family services, because that was a reoccurring theme in conversations. And we wanted to give them the opportunity to share, what would you say to these workers about your cannabis access and consumption as a pregnant person or parent? And so through all of those sessions, these were our key findings. We found there was a key connection in cannabis consumption and mental health, the impacts of stigma and surveillance, the barriers to accessing care and information on cannabis during pregnancy, breastfeeding, and parenting, and also the importance of supporting mothers who consume in ways that work.
My mental health wasn't very well. I felt like I wasn't in my own body. It was an out-of-body experience, pregnancy itself. And I was probably worried about things. And then with cannabis, I just felt like I was able to grow and I was able to calm down. There were many women, of the 23, I would say almost most of the women spoke about using cannabis to support them with their mental health and well-being. In particular, a common theme was issues related to historical trauma related to violence and sexual assault, to experiences of living in poverty, of having historical experiences of child welfare involved in their own parents' lives, as well as their own, racism, and impacts of colonization on their lives. And for many of them, they made that direct connection between what it was to be a parent living with the impacts of that trauma and how it results in daily anxiety, and cannabis as a management tool for that anxiety. And as one mom says, it helps me, it keeps me in a sense grounded and present with my relationship with my son. This also came up during the breastfeeding period of a mother's life, where they were really sort of dealing with this tension between wanting to bond with their baby, breast is best, so definitely wanting to breastfeed, and yet experiencing a lot of anxiety around the breastfeeding act itself. And again, feeling that, through the way in which cannabis supported them to just feel calmer, that this would enable them to be calm enough to handle the act of breastfeeding. And so you can see that, a nuance here is, how do I sort of give my baby what I want? Breast is best, and yet not sure about cannabis. And it really does highlight the need for a particular kind of clinical care and social work support. And this is another poem by one of the participants. The darkness comes easily for me. My entire being demands it at the times I'm most vulnerable. Vicious and cunning, the process seems to be as it quickly takes away all my drive to defeat it. Alone, even in a room full of love, trapped, even though my love is unconditional for them, the flower brings me solace, peace, strength, and contentment, at least for a little bit. Enough time for me to quit my fear and loathing and quickly go to a place where I can be me for them. Another recurring theme was their experiences of stigma and surveillance. Again, you can imagine, given their experiences of poverty, racism, indigeneity, harm reduction, so drug use backgrounds, there was a lot of fear around speaking and sharing about cannabis during pregnancy and parenthood. And as one person said, there are a lot of people who are now digging into different parts of your life simply because you're using cannabis. It's important to say that in my own sort of delving into research and talking to people working on the front lines of social services, is that it's kind of common knowledge that you would never open up a case or do a home visit just because somebody is consuming, a parent is consuming cannabis. And yet we were hearing stories, not just in the young mothers group, but actually throughout all of the groups around fear of being stigmatized for consuming cannabis, and stories related to having home visits, social workers checking in on them and connecting with them based on their concerns around the parents' cannabis consumption. And as you can see here, the mothers were talking about how that fear about the CAS involvement and the surveillance that accompanies that really prevented them from reaching out even when they needed support at a time of crisis. And so as a result, as one mom said, we keep everything inside because we're so afraid of the consequences being having their children taken away. And another parent sharing that, she's never expressed her cannabis consumption to her doctor, midwives, or doula. And she said, even though it was something that I was experiencing on my own, I never felt comfortable to talk about that because I already had an idea of where that conversation would go, and I would feel judged. So just to say, these weren't sort of imagined stories of stigma and surveillance. They were based on historical experience of being surveilled, even if it wasn't for cannabis use, for other things in their lives, and really worried about what that would mean if they were to share something so personal. And while cannabis is legalized and may have resulted in a lack of stigma for many people, that certainly isn't the case for people who are living in more marginalized contexts. And so then, as a result of the fears of stigma and surveillance, this really did create barriers to accessing care and information on cannabis at this time in their lives. And it's really interesting listening to data that's coming out and really welcoming the really important information that's emerging through my colleagues here around, for example, the impact of breastfeeding on the newborn baby, and this is actually information that the mothers all said that they wanted, but it was really, really hard to find. And if they could find something, it was in a language that just did not make any sense to them whatsoever. And so then to actually speak to it, ask their healthcare provider or their social worker, because of the stigma and the surveillance and the concerns and the fears, they were kind of in this limbo state, and did talk often about wanting hardcore facts, information, and scientific studies to help them make educated choices. And that's a picture of a broken telephone. And one of the women talked about, there's so many mixed messages. She would read articles written by scientists online and stories of lived experience. And, it was just I can't make head or tail. There's so many mixed messages. There's so many mixed stories. But for her, the broken telephone signified not being able to speak about cannabis at all because of the fear associated with that. And here's another image by another mother in our study who talks about literally facing the opposite towards information that should be accessible, that isn't accessible, because no one really feels safe to communicate because of the stigma tied to the use of cannabis.
And through all of that, we learned that what we need to be focusing on is supporting mothers who consume in ways that work, meeting them where they're at and understanding that we're there to support their journey and give them information so that they can make these informed choices. One of the participants shared her experience of working with her midwife, who supported her to come up with a cannabis plan to help her stay off of drugs and alcohol during pregnancy, and continue that journey afterwards as well through postpartum. Because she says here, we don't consider smoking weed as not being sober. It's a medicine, and it's always been a medicine in our home. And along with support from health and social workers, there was also a really important theme around community and being able to connect with people and show up as your full self and talk about the vastness of it all through parenting and pregnancy and breastfeeding, and talk about how we use it and how we see cannabis as a medicine, how we see it as something that helps us mentally, helps us physically, even spiritually. And this information needs to be accessible. People need to have a space to talk about it. And because there isn't those spaces, or people don't feel safe to go to the spaces that are available, people take to the internet. And this mother here shares, I'd rather just take advice and have conversations, connect with other parents who have gone through this experience when it comes to consuming cannabis. And this is what the photo displays, just everyone's experience. And I think experience and connection and community is everything. And this is a screenshot from a Facebook group of all these different folks sharing their lived experiences. And
what's going on?
When we're thinking about supporting mothers in ways that work, seeing how important it is for these parents to have community, to have the information and have the resources, how can we as providers hold and open that space for these parents to get the access to the information they need and deserve, truly?
We just wanted to do a quick shout out to our research team, which includes people with lived experience, frontline health and social care providers, researchers, and a big shout out to all the women that participated in the study. And we did feel it was important, though, to end specifically with the words of one of our participants who talks about the need for truth in her relationship with healthcare providers. I see the word truth, and the turtle in sharing circles represents truth. And then just being truthful with the medical team and letting them know that you want them to be truthful with you as well. And that's a two-way street. My doctor is a great support for me, and she's supportive of my cannabis use and encourages it. Thank you. I don't know if there are any questions or if there's a way to get questions to us.
Thank you, Saara and Gabrielle. That was a really nice sort of perspective. You sort of ended on where I was going to ask the question, which is the viewpoint of the participants towards healthcare workers. I was wondering if when you talked about barriers and things, what was overall, like that was one viewpoint, but did others also talk about a perspective on healthcare workers and whether they felt safe there or whether they were going for information to healthcare workers specifically?
Yeah, thanks for that question. That's a really good one. So what emerged as really significant and interesting to us was that for those parents that have, those mothers that had close relationships with a midwife, we heard about a relationship that supported them to share honestly about their cannabis use, which really then helped the midwife and the mother to work together to develop a plan. And I think just to sort of say, connect back to some earlier findings, is that we found that a trauma-informed approach was something that was really helpful in supporting mothers who consume cannabis during pregnancy and breastfeeding and beyond, because it kind of shifted the narrative from a you must not, or to make mothers feel even guiltier or feeling badly about themselves, but actually to really take this harm reduction and trauma-informed approach that understood the context in which decisions around cannabis consumption is being made. It's a lot to ask somebody to make a decision between sustaining their mental health and well-being and not smoking or ingesting cannabis in another form. It's like they're in conflict, right? Because both may have adverse effects. So really what they're asking for is this trauma-informed approach, having heard that there are some people that have had that experience with the midwife. There were some, as you heard at the very end, who also had a great experience that was similar with their physician, with their OBGYN. But most of them chose not to share, were really scared to share because of other experiences that they've had in their lives with physicians, with emergency room attendants, with social workers. I hope that answered your question. Sorry, we're just looking in the chat. We've just been, sorry. Oh, we've just been, I don't know if anybody can still hear us. I just wanted to answer the question that the work is ongoing. Thank you.